Good morning, everyone. This is Eileen Doherty, and I'm the director of the Colorado Gerontological Society. And I would like to welcome you all to our presentation this morning. We have done this meeting for many, many years. It has occurred at the second Tuesday of every month, pretty much every month for the last 40-some years in Colorado. We had previously called it the Senior Issues Briefing. We are looking at a new name for it. So at the moment, we are calling it Aging in the Know. Hopefully we will settle on this title, but we may change it in the future. So what I'd like to do this morning is that some of you may know that the Colorado Division of Insurance has created a special enrollment period for individuals who have Medicare supplements. So I'd like to briefly go through that this morning. First off, we'll do a very brief overview on Medicare. Medicare has 4 parts. We are only concerned this morning about 3 of those parts, and we're really only concerned about 2 of those parts. So we're concerned about Medicare Part A, which is hospital insurance, which covers hospital care, a little bit of skilled rehab in a nursing home, if you have had a 3-day hospital stay, some home health care and hospice care. Medicare Part B covers medical insurance, and this covers a wide variety of things, including things like doctor's visits, labs, x-rays, preventive services, ambulances, outpatient surgeries, just a wide variety of things. And then Medicare Part D covers prescription drugs. There is a premium that is paid by that has paid for parts A, B, C, and D. A is free to most people, so you don't pay anything for it. B, there is a premium paid by most beneficiaries unless you're on some government benefit program like Medicaid or the Medicare Savings Program. Medicare Part C, which is Medicare Advantage, or like HMOs, PPOs, or private fee-for-service. Some of those plans have a monthly premium and some do not. And then there is the Medicare Part D, and those premiums are paid by beneficiaries. What we are most concerned about this morning is Medicare Part A and Medicare Part B. So Medicare supplements are the same as a Medigap policy. You will hear those terms used interchangeably, both in the literature, when you search for this online, or if you are talking to an insurance broker. So do not be confused that a supplement is different than a Medigap policy. The basics in terms of a Medicare supplement is that the very first thing is that they have a guaranteed issue regardless of pre-existing conditions. Usually you only get this guaranteed issue within the first 6 months after you enroll in Medicare, unless for some reason or other you have been enrolled in an employer group plan that has had comparable coverage. Other things that Medicare supplements do is that they do have a guaranteed renewable, meaning that regardless of how many claims you make, you are still eligible for coverage. They can't drop you just because you had $100,000 or $200,000 claim. They have to guarantee, or they have to continue to cover you. Another feature about Medicare supplements is that the plans are standardized across companies. So there are a number of plans, and regardless of what company you purchase it from, the benefits of a plan A are the same regardless of the company offering the services. The rates are annually approved through the Colorado Division of Insurance. They do have a fully refundable premium, and the physician or the provider submits the claim to Medicare. Medicare, once they have paid, then automatically submits that claim to the Medicare supplement for the balance of the payment. And then if there's anything due based on the type of coverage that you have, then you will get a bill from the provider. Another feature of the Medicare supplement is that you can use any provider in the United States that accepts Medicare, and you can self-refer to specialists or other types of care. So as I said a few minutes ago, one of the big features of a Medicare supplement is that you have this guaranteed issue, regardless of pre-existing conditions. What has happened is that we have advocated as a group of advocates to the Colorado Department of our Division of Insurance to create a special enrollment period for Medicare supplements for people who have a Medicare supplement, which means then that you can change your current Medicare supplement if you have a plan C, F, or F plus during this special enrollment period. You can also change regardless of what your pre-existing conditions are. So if you have either have had or currently have any kind of condition that may not allow you to change Medicare supplements from one company to another because of the pre-existing condition, in this special enrollment period, you will be able to make some changes. So if you have cancer, if you had a heart attack, kidney problems, anything like that, you'll be able to change. The rates for a Medicare supplement are determined basically through either attained age, community rating, or issue age. Most of the companies in Colorado use what they call attained age. And what that means is that there is a different rate for people who are 65 to 69 versus people who are 70 to 74 versus individuals 75 to 79, et cetera. And within that rate band, if you will, then the basic premium is the same, regardless of how many services you use, how many claims you have had. So most of the companies use attained age. They are allowed to determine whether or not you are a smoker or a non-smoker. They are allowed to have different rates if you are a male or a female. They are also allowed to have different rates depending on where you live in the state of Colorado. And lastly, the company has to provide rationalization to the Colorado Division of Insurance on their loss ratios, meaning how many claims did you pay last year? And then based on that, they will determine whether or not there is a change in the rate. So the Colorado Division of Insurance has approved the special enrollment period, or you may hear it referred to as an SEP, for individuals who have a Medicare Part C, it should be plan, it should, Part C plan. So Medicare has parts, and then this is actually incorrect. It should be a plan or Part D. So if you have a plan, a Part C, an F, or an F plus, if you have those plans, then you can change between January 1 to June the 30th, 2021. So this should say actually, if you have a Medicare plan C, F, or F plus through a Medicare supplement company, then you can change. And you can change from a C to a D. You can change from an F to a G, or you can change from an F plus to a G plus. You can do that within the company that you are currently insured, or you can change companies. So what this particular chart does is the 3 highlighted plans in Part C, F, and F plus are the ones that you can change out of, and you can change out of them into their respective ones. What is happening with this current special enrollment is that, as you can see, the Part A deductible, which is what you pay if you go to the hospital, is paid for across the way here. So if you have a Plan A, it's not paid for. If you have a Plan C, it is covered. If you have a K, an L, or an M, why then it's covered at a certain percentage. The coinsurance, which this is the amount of money that if you are either in the hospital past a certain number of days, or you are in a skilled rehab facility and there is a copay, as you can see, that one is paid all the way across as well. The Part B deductible is paid by a Plan C, a Plan F, and a Plan F plus. This is the primary change that is made by the federal government that says starting January 1, 2020, individuals who are not in one of these plans will have to pay their Medicare Part B deductible. Part B also covers the 20% coinsurance, and you can see again, all of the plans cover that. The excess, which is the 20%, or which is the 15% over and above what the doctor is allowed to charge if Medicare does not accept assignment. And as you can see, a Plan F and an F plus, a G and a G plus are the ones that cover that. This has been the primary feature why most people who have enrolled in a Medicare supplement have basically selected an F, because it paid for the excess charges and it paid for the A deductible and the B deductible. So pretty much you had no out-of-pocket expenses. All of them pay some or all of the cost of blood, and all of them pay some or all of the rehab costs, as well as some out-of-pocket for foreign travel. So what are the major differences then between a C, a D, an F, and a G, and an F plus and a G plus? So as I said, the C pays the Part B deductible, as does the F. The excess charges are only paid, are paid then by an F, a G, an F plus, or a G plus. So that was why for years and years and years, we have directed people to go to the Plan F. That has made this pool of beneficiaries very large, but because we cannot sell it anymore, that pool is going to be decreasing. So how much will you have to pay for the Medicare Part B deductible? Basically in 2021, that is $203. And if you decide to keep your Plan F or your C or your F plus, it will continue to pay those. If you switch to a D or a G or G plus, then you will have to pay the first $203 every year when you see the use medical services. The excess charges, which is 20% above the Medicare approved charges, F, G, F plus, and G plus also continue to pay those. So why should you consider changing policies? Because one is that there are no new policies that can be sold as of January 1, 2020. This means that the risk pool, as I said earlier, will decrease. What we know from past experience is that there used to be a Plan J. And Plan J had a small prescription drug benefit associated with it. Most people, when Medicare Part D was approved about 10 or 15 years ago, chose to drop their Plan J because we had a similar type of special enrollment period and go with a Plan F, and then purchase a standalone Medicare Part D plan. However, there are some people who did decide not to change their J, to stay with it, rather than to enroll in Medicare Part D. What we have now today is one lady told me in 2019 that her premium for Plan J had gone from $200 or $300 over the 10 years up to about $800. And unfortunately, now she is stuck with that because she could leave her J, but she can't go to any other Medicare supplement with a guaranteed issue. And she can't go to a Plan D or a prescription drug plan because she she would have significant penalties. And she was really feeling very stuck because she hadn't taken that advice. So basically, our concern based on that experience is that the insurance companies will eventually increase premiums for C, F, and F+. We also are concerned, to be honest with you, that we may see some increases in the G plans as well, but we don't know that for sure. What I have provided you here is a list of the companies in Colorado that are licensed to sell a Plan G. All of them have filed as of last fall with the Colorado Department of Insurance and have been approved to do that. So one of the things then that I did is that the Colorado Division of Insurance actually also publishes by selected zip codes and for selected age bands, the rates or the premiums that they are that they have approved for different companies. So what I just wanted to show is that I selected 4 companies: AARP, Bankers, Nassau, Humana, and Anthem. I guess it's 5 companies. And their approved rate for a female on a Plan C is $165. For a male, it's $186. For a Plan F, it's $165 and $187. And what they filed for 2021 is $120 versus $135. So you can see there is some significant difference in premium. AARP is not offering an F+, and nor are they offering a G+. I did hear that AARP United Healthcare had filed for a rate increase sometime this summer, and I do not know exactly what that will look like. This is also the rate for someone who lives in zip code 8020, which is downtown Denver, but pretty much Metro Denver follows the same rates as does the downtown. So you can see Bankers Life never did offer a Plan C. They're not offering a D. They offer an F, which is $173 and $194. Currently, if you buy a G, you can get in for $138, $164. They offer an F+, which we can't sell anymore, and none of the companies in Colorado actually in the fall of 2020 were approved to sell a G+. Nassau, as you can see, also has not much variation between an F and a G. Humana has some variation, and Anthem has quite a bit of variation. So again, when I say that you should shop these plans on brand loyalty and price, some people will buy just because they have always worked with United Healthcare, or they've always worked with State Farm or Mutual of Omaha. Other people will shop them based on their pricing and try to estimate what the prices might be in the future. So it's really kind of a decision as to whether or not you want to stay with your F, which probably will increase in premiums, or whether you want to go with a G and see maybe some at least temporary reduction in your premiums, or if you want to go with a plan C. And the ones I happen to select here don't offer a plan D, but some of them did on the state's website. So how do you go about changing plans? You will need to go through an agent. Medicare supplements are not sold through the internet or through an online platform. So if you don't currently have an agent who is that you have worked with, you've just kind of been continuing on to pay your premiums and you've lost contact with your original agent, I'm recommending some people, I did some counseling on this the other day, that you check with the agent who has your homeowners or your auto insurance. And some of those agents are also licensed to sell health and life insurance. And if they are, they may be able to sell you a Medicare supplement if they are licensed as an agent or a broker with a specific company. You may also want to look for a broker as opposed to an agent. The benefit of as a broker is that they can sell for multiple companies that they are licensed to do business with. An agent usually is only licensed to sell one company. And so that may be something that you want to check as well, especially if you're looking to do some comparison shopping. Another way to find an agent is to check with friends. They may be able to make some referrals. And if you do need a referral, we do work with some agents and brokers through our office, and we're happy to provide you with 2 or 3 names of individuals that you could contact, and they probably could assist you. Another thing that you can do, but you do have to have a name, is you can check with the Colorado Department of Regulatory Agencies, and you can find out which agents are licensed to sell Medicare or health insurance or Medicare supplements in Colorado. So what else do you need to do if you decide that you are going to move from a C or an F? You will then need to contact your broker or your agent. You will need the date that you received Medicare Part A and B, and this will be on your Medicare card. You will need your Medicare number. Depending on which company you write with, you may have to pay a premium. I actually switched my husband from his State Farm Plan F because he's quite a bit older than I am, and it made sense at that point in time to have him enrolled in an F when he became 65, to a G this week. And because there was a significant reduction in the premium, and his is paid on a quarterly basis, they did not collect a premium. So you may or may not have to pay a premium. If you go with a new company, you most likely will have to pay a premium. Medicare supplement premiums are usually collected in advance. This is actually a good thing, because then if you happen to be a few days late with your payment, then you don't lose your coverage. So what can you do to share this opportunity? So the deadline basically is to change is June the 30th, 2021. And because we're only one small agency, we are really encouraging everybody to call family, friends, and colleagues to encourage them to at least review this opportunity. I will say that many of the insurance companies have been notifying their policyholders of this change, but it doesn't necessarily resonate, if you will, with the individual about what the implications of the change are. I also know that some agents, I don't know if all of them are actually also contacting their policyholders, and we're very encouraged by that. If you have any way to put information in news outlets, whether it's local newspapers, whether you have a radio program. For example, one of our board members has a radio program down in Alamosa. And so we're encouraging people to use whatever means that they have in terms of company newsletters, homeowners association newsletters, neighborhood newsletters, next door, if you're part of that group, any way that you can to get the word out. If you want to use the Gerontological Society as a contact point to explain it, we're happy to have you do that as well. We would also encourage you to put it on social media. And if you don't know exactly what to do, if you're not currently following the Gerontological Society on Facebook or on Twitter or LinkedIn or Instagram, we invite you to do that. And then you could just share or forward the posts that we do. You can also share or forward the this PowerPoint, which will be available after the session today, or you could forward the email. Whatever you can do to help us would be greatly appreciated, because what will make me very sad is if I get a whole bunch of calls in July of 2021 from people who say, I didn't know about this, and we just didn't reach them. So whatever you can do to help, that would be great. I'm going to stop for a couple of minutes here and see if Maria has any questions in the chat or in the Q&A. And if not, well, then I have a couple of other slides following this.
So Eileen, we do have a question. The question reads, what are the F and G plus programs? Not familiar with the plus versions.
Okay, the F plus and the G plus were programs where there was where it was not first dollar coverage. So you pay a certain amount of money, usually several $1,000s out of pocket before the insurance company actually starts to pay. For some people who were low utilizers of health insurance coverage, they opted to buy an F plus because it kept their premiums down. And if they didn't use very much health care, they were able to save some premium dollars and then just pay out of pocket. And they also were able, as an individual, if in fact they used up to the maximum amount of that money, they were able to cover that through other resources rather than to use their insurance. G works exactly the same way, G plus, but at this point in time, none of the companies in Colorado, according to the Division of Insurance, are selling a G plus. So if you have an F plus plan and you wish to change, you should consider just changing it to a G, because you won't be able to take advantage of the reduced premiums through a G plus at this time.
The next question we have is, what insurance companies offer plans in Garfield, Colorado?
We will need to check specifically with the Colorado Division of Insurance. Most companies will write in the state of Colorado. The usual criteria, to be honest with you, is what are the brokers that you might work with licensed to sell. But most companies, they don't really care where you live. They're just, so most companies should be available regardless of where you live. The bigger challenge will be finding a broker that sells the company that you want.
The next question we have, will there be a special enrollment period at the end of the year?
There will not be a special enrollment for switching from a plan C or F plus. That special enrollment period will expire the end of June 30th, 2021. There will be other special enrollment periods, most likely at the end of the year, but we don't really know what special enrollments will be. Those usually are driven by Medicare Advantage plans or Medicare Part D plans leaving the service area.
We don't have any additional questions at this time.
Okay. Okay, then I just have a couple of things to share with you about the Gerontological Society. And if anybody has any additional questions, feel free to put those in the chat, or you can contact us afterwards. So a program that the Society started about a year ago is the Telephone Buddy program. And we started that primarily because we were getting a lot of calls from older adults who were very isolated. They were concerned and anxious about how they were going to get food and medicine as we were going into the pandemic. And they saw themselves or felt very, very lonely and isolated and cut off. So we started a program called the Telephone Buddy, and we have had extraordinary support, if you will, from community volunteers. We also continue on a regular basis to get calls from older adults who want a telephone buddy. We did get some funding to support this through the end of 2022. So we're excited that we'll be able to continue for at least a couple of years. So what's involved in a Telephone Buddy program, if you want to be one, is that if you have about an extra half hour or so a week, you as a volunteer call an older adult once or twice a week. You check in with them about whether or not they have food, prescriptions, if they need anything special, if you could share information with them, share things about what you've been doing, ask them what they've been doing. And the calls are basically 10 to 15 minutes per person per call. So if you make 2 calls a week, that's about 20 or 30 minutes. And then it takes about 5 minutes to report the call through our tracking system. Because we have to basically report all those calls to the funding agency. The other thing that the funding agency that gave us the primary money to support this program, they are really interested in the peer-to-peer support that is being provided by community volunteers to basically reduce isolation and depression, rather than to know that everybody who experiences these feelings really may not need psychiatric or psychological intervention, that they're really just very lonely and need support. We do provide a short training session, and we do have to do a CBI check. So then once you go through the training, we do a training usually weekly. So if anybody is interested in signing up for this program, you can send us an email at cogs@senioranswers.org, or you can put your name in the chat and we will contact you that way as well. The other thing that we are doing, and the pandemic has had both positive and negative things in terms of different programs that the society is offering. So we have some work that we are currently doing in the area of housing advocacy. And some of the questions that we are looking at in terms of this advocacy effort is we are looking at the high cost of rent, and what that means for people who want to continue to, live in their own apartment, whose income basically does not pay or leave very much money available. So one of the things that we're looking at is how do we address the issue of high rents? A second issue that we are looking to address is how to help people to age in place, and how do we do that successfully. A third area that we're looking at is property taxes and what the implications are related to keeping property taxes within reach of people, especially since the Gallagher Amendment is no longer in place as of January 1, based on voters approving to no longer have the Gallagher Amendment, which kept your property taxes low. As of this moment, we still have the senior homestead exemption, but it is always under threat as well. So we're going to be doing some community advocacy programming. We're also going to be doing some advocacy associated with community groups who want to be involved with that. So if you would like to join us for the next couple of months on looking at ways to age in place, we'll be doing these different topics from 1 to 2 in March, April, May, and June. In addition to that, one of the things that a number of people told us last year is that they would like to be more involved in work at the legislature. So starting this coming Friday through June the 11th, from 1:30 to 2:30 every Friday afternoon, we will do some work around advocacy, both in the area of the legislature as well as rulemaking. We'll look at bills that are currently affecting older adults and sharing their current status, as well as any new bills that are introduced. And we will be providing opportunities, if you will, for people who want to get involved in the advocacy process. As I frequently say, getting a bill passed through the legislature and signed by the governor is usually only half of the battle, because oftentimes, as you have all, I'm sure, heard many times, the devil is in the details, and those details usually happen at the regulatory level when rules are made. So many times we are also working with regulators about different rules and how those can be most effectively used and accessed by older adults. So those meetings will occur every Friday from 1:30 to 2:30, and we look forward to having you join us. We will conduct this meeting once a month on the second Tuesday. And if you want to go ahead and mark your calendar, these are the dates that we'll be doing it, from 10:30 to 11:30. And I've gone ahead and identified some topics for the next couple of months. And if anybody has any topics that you would like us to cover, either in this series or in other programming, we are open to hearing from you. I also want to do a plug. Maria has been doing a significant number of sessions on advanced care planning over the last couple of months. And Pat has been working with her as well on some sessions on elder abuse. So if you have not had an opportunity to join her in those different sessions, we invite you to contact us or to go to our YouTube channel, and you should be able to access those there. So Maria, before we sign off, do we have any other questions?
Yes, we do have another question. It's a telephone buddies question. Do you call the same people every week, or is it always, or is it a different person every time?
You call the same person every week. You are assigned to someone, and the goal is to establish a relationship between you as the telephone buddy and that older adult. And we are getting incredible feedback. One of the things that we also have to do is a survey among the older adults who are in the program. And we are getting incredible feedback from the older adults who are really, really very appreciative of the phone calls. We've also been able to use the telephone buddies to identify some pretty significant situations. So for example, a week or so ago, we had a telephone buddy call us, and her older adult had shared with her that she thought she had been a victim of her identity had been stolen, and all of her credit cards and her driver's license. And so we've been working with her for the last week to get that remedied. And trying to figure out all the different things that we need to work with her in terms of the credit bureaus, in terms of getting Social Security cards replaced, driver's licenses. And it was basically the older adult felt comfortable telling her telephone buddy that this had happened. She didn't call her family, but she told her telephone buddy because she was very scared about what had happened. Other times we get calls for things like the older adult needs food, or they need a prescription, or a variety of things. So basically you kind of become the eyes and ears, if you will. We don't expect you as the telephone buddy to do anything when you identify these problems. You merely just notify our office. That's why we have the reporting form, and then you indicate if we need to follow up. And if we do, then you put that in the form as well, in the report. And then we check those reports on a daily basis so that we know how and what we need to do. I do always tell people that if your telephone buddy, or if you report that somebody needs food, that's going to get a much higher priority than somebody who reports that they need a library book. Again, not that the library book isn't important and that we won't work to see how we can make that happen. But if I'm prioritizing in the next 2 hours, what I have to do, I'm going to prioritize food over the library book, and I might not get to the library book until the end of the week. It's been a very, very beneficial program, and people are giving it very, very high marks in terms of the benefits that it has provided to them. So if you would like to be involved, we do have a training again this week on Thursday afternoon at 4 o'clock, and we can send you that information as well. Any other questions?
No additional questions.
Okay. Well, as they say sometimes on the state calls, it's only 11:17. So I will give you a few minutes back of your day today. Thank you for joining us, and let us know if we can help you. You have our email and telephone number on this closing screen. Look forward to seeing you soon, and take care and have a great week.